Hello everybody, it's really nice to meet you. My name is Becky Canning and I work at CU Scarborough. I'm one of the course leaders for Health and Education. I also teach on our Foundation Health and Social Care course, our Health and Social Care degree, and our Public Health and Community Studies degree. At CU Scarborough, we're really excited that we're now going to be working in partnership with the UTC on their health and social care pathways. This short PowerPoint presentation will tell you a little bit about what to expect when studying health and social care, where you may work in health and social care, and the benefits of choosing to study a BTEC Level 3 Health and Social Care at the UTC. So let's begin. So what is health and social care? Well, health and social care is really any organisation that provides healthcare support to people or social care support. By this, we mean physical, emotional, or social support that allows people to live their own lives. And there are many, many different roles within the health and social care sector. In fact, it's one of the largest and fastest growing areas of employment, especially as we see the population of the UK beginning to age. And the challenge of ageing means that more so than ever, we need professionals to work in the adult health and social care sector. There are many different organisations that employ people in health and social care roles. Health and social care is rewarding, it's fun, it's exciting, no day is the same, and you'll be making a difference in people's lives. In fact, many of the jobs in health and social care you may never even have heard of, and there are lots of fun ones available too. These are just some of the things that people may do in a role in health and social care. You might think about going into nursing, being a social worker, working in the charitable sector, in the drug and alcohol addiction services sector, working with people with learning disabilities, with children and young people, with those people with mental health problems and ill health. You might look at the area of health promotion, and this might include sport and nutrition. How can we encourage people to live really healthy lives? There are lots and lots and lots of different professions within health and social care. And there are many different routes into these professions. Some of the jobs on my previous slide and others that you might be able to think of will require specific graduate level qualifications in order to gain employment in the industry. But not all jobs in health and social care do require graduate qualifications. But by studying at level 3, you're allowing yourself the opportunity to continue that progression journey. Whatever you choose to do, experience, volunteering, skills such as empathy, compassion, respect, dignity, being caring, an excellent communicator, being compassionate about people, enthusiastic about change. All of these skills are vital to people who choose to work in health and social care. And whilst there are many different routes into health and social care, and these can include graduate entry positions, non-graduate entry positions, people who have A-levels, BTECs, and a range of other qualifications. The UTC is now going to be offering a Level 3 BTEC in health and social care, alongside other qualifications. So, why would you study health and social care? Well, we've already heard it's one of the biggest sectors of employment in the UK. There are lots of jobs available, and there's lots of variety of the jobs that are available. There's something for everybody. You're never going to get bored, and more than anything, you're going to have job satisfaction. But beginning to study health and social care now allows you to understand more and more about what it would be like to work in the sector and provide you with those underlying skills. The BTEC Level 3 National Diploma in Health and Social Care that will be run by Scarborough UTC, and we're going to be partnering with ourselves at CU Scarborough, will allow you to understand the fundamentals around working in health and social care. You'll get an opportunity to find out the key skills and knowledge that you would need to work in this sector. You'll learn about equality, diversity, person-centred care, respect, holistic care. You'll learn about interprofessional working and the standards and skills required to be successful in the health and social care sector. You'll study modules such as safe and effective practice that will teach you about the legislation, that's law, that exists in this country to ensure that people who use health and social care services receive the best service possible. You'll learn about how services such as the NHS, the independent sector such as care homes, GPs, dentists, etc. are all regulated, governed. How do we make sure they're doing a really good job? You'll find out why safe and effective practice is so important. You'll learn about safeguarding, about when working with children, young people and vulnerable adults, why it's important to make sure that we tailor the care that we're delivering to their needs, that's called person-centred care, but we also manage the risks associated with it. You know, we can't remove risk from our lives altogether. We all take risks every day. But when we're working in health and social care, it's important that we understand how we balance those risks with people's wishes and needs and desires in order to provide really good quality care. We're also going to have to learn about some of the times when health and social care has gone wrong, where mistakes have been made and how we've learned from those. That's called reflective practice. You'll get an opportunity to learn about individual needs, about lifespan development, around public health and what public health is and the importance of promoting health within the population. You'll have the opportunity to learn about nutrition and the importance of a healthy lifestyle and how we support other people to do that. Over the 2 years that you study the BTEC Level 3 National Diploma in Health and Social Care, you'll also have opportunities to visit us and work with us at CU Scarborough. To access our facilities, we'll be supporting you with enrichment activities and a whole collection of things that will help you develop the skills that you'll need alongside your qualification to work in health and social care. So what will you study? Well, I've given you a bit of an overview of some of the things that you might study, but let's find out a little bit more about 2 of the areas that you may study in your BTEC Level 3 Health and Social Care qualification.
Hi, I am Dr. Hannah Dege, and I'm a tutor in health in Coventry University, Scarborough, and I'll be speaking briefly about public health and of what relevance it is to study public health. I'll use the iceberg phenomenon to explain what public health is. The iceberg we know has 2 major portions. The tip, which describes the disease and health conditions that take people to GPs or hospitals. The larger hidden portion describes those conditions that could make people become poorly. So public health works around addressing those larger hidden things to prevent people from getting poorly and having to go to hospitals or clinics. So public health is around the 3 P's: promoting, preventing, and prolonging lives through organized efforts within the society. The public health movement in the UK dates back to the early 16th, 15th century, from the Poor Law in 1601 to the sanitation movement in 1842. And if we fast forward to what is happening now, public health has been in the forefront in responding and dealing with the COVID-19 pandemic. Some of the topics that are studied in public health include health promotion models and theories, communication skills, epidemiology, where you study about causes and patterns in understanding how to prevent diseases. You also do things around health policy, health needs assessment, all of these to help you to understand how to deal with issues that would prolong, prevent, and protect people within the community. So why is it important to study public health? It provides you with the skills as well as knowledge to understand those factors that affect health status as well as the pattern of ill health, so that you can provide appropriate interventions that would help to promote and prevent disease, as well as advocate for policy change. So if you would ask me, I would say studying public health is the best thing to do. Thank you.
Lifespan development involves learning about each stage of life through conception to birth, through childhood and adolescence, adulthood and older ages, through to the process of dying. It includes the developmental milestones, not just biologically, but psychologically and sociologically. You will discuss how social change can impact on development. For example, how social pressures can impact on relationships, identities, childbirth, and aging. You will explore psychological development through learning about the different theories of psychology. And more obviously, you will look at how the human body grows and ages at each stage. Identity and the self are interesting concepts you will explore. We can learn more about others through developing our awareness of ourselves. People often view themselves through the lens of others, and this may differ greatly to how they see themselves, their own self-image, self-esteem, self-concept, and identity. Our identities can be impacted by how we believe society sees us and how we see society. Our behaviours can be impacted by our self-concept and our identities. Ask yourself, who am I? You will learn about the ways that people grow and adapt to both the good and the challenging situations that life brings. You will be able to treat people individually, personally, and meet their needs. To consider a person's life stage when reviewing their healthcare needs means that you can tailor the services provided to them. This will improve health outcomes and help to reduce health inequalities.
So CU Scarborough is really excited to be opening its doors to work alongside the UTC, to share with you our skills and experience, our facilities and our enthusiasm for health and social care. We're excited to begin our partnership journey with you in September, and we look forward to meeting you, to sharing our enthusiasm with you, and to allowing you to find out more about the challenges of working in health and social care, the rewards of working in the sector, and the passion and enthusiasm that you will have for this sector as you move forward. Wish you all the best as you begin your health and social care journey, and I look forward to seeing you all when you begin the new academic year in September. Thank you.